Well, I was having a lot of problems with my stomach. Couldn't figure out what was going on with me. I couldn't afford the medical insurance here in San Diego, even when I was employed. I couldn't afford it. When I called to get assistance, I was told of a great program for medical insurance. I haven't seen a doctor in 7 years. You know, I didn't think there was anything out there for people like us, but there actually is. People just need to know about the 211 program.
Because there is another program called the Low Income Health Program.
When I first called the 211, I was telling her my situation, and immediately she started explaining to me what it was about, how it worked, and we went from there. And the same very day I was approved, the next day I was able to go see a doctor.
So I was able to do all her application over the phone with her in less than 30 minutes, and she was approved. Next week she had her insurance and she was seeing a doctor.
Well, they did inform me that I do have stomach cancer, which right now we're in the process of trying to get it treated and medications, which was a great thing for me because, like I said, 7 years, if it wasn't for 211, I wouldn't be sitting here today.
Ascension Health is really interested in improving the health of communities that they serve. And so we developed a pilot project with 211 call centers in San Diego, Nashville, and Palm Beach County, Florida, to test the idea of using these 211 call centers as a sort of hub for health navigation services.
211, this is Millie speaking. How can I help you?
My role here is to assist the underserved clients in Nashville as far as healthcare, help them to overcome some of the barriers that they encounter.
You're in touch with the American Cancer Foundation.
The health navigation program gets a variety of clients. People low income, middle income.
It could be an individual, it could be a family.
Sometimes people who have businesses, but they just don't have health insurance and they don't know how to go about it.
Our average patient range is between 20 and 45, so in their prime working years.
Some people tend to think of 211 as a service for the poor, but that's certainly not true. It's a service for anyone in the community who needs assistance.
He has extremely high diabetes.
When people have a need and they don't know where to turn, they don't know where to go, a lot of times they call 211.
Having someone there to talk to you and say they understand and they want to help you, you can't be replaced. So that human element, that connection is vital.
I had no insurance coverage, and I had some pressing health issues. I've got high blood pressure in my family, so I needed to get on medication quickly. Wasn't able to afford healthcare coverage, didn't really know where to go. It was all really confusing and just trying to go through it myself in the yellow pages, and just really found myself at a loss for what to do next, and it was kind of becoming crisis time. So I found out about the health navigation program through 211 and called and started working with the health navigator. She did it in a human way where a lot of this stuff's really confusing when you hear it for the first time, so she just kind of walked me through it slowly, let me know what my options were. And she really helped me get past that barrier where I just felt like I couldn't go any further and needed help.
I think that the 211 health navigation is a great access for the patients to help them to get in where otherwise they wouldn't have anywhere to go.
Partnering with 211, they're able to navigate patients to see us if patients need to be seen in a very timely manner, and we have space available, we see them right away.
We are coming together as a community and being able to pull in teamwork to make everyone in the community have access to care.
I remember the first time that Frances called me in a moment of crisis. She was going through many health issues, didn't know where to turn.
I had health issues and didn't have any insurance or, worked on a job where there was no benefits or anything. And by going through so much pain, I didn't know what I was going to do.
So as a health navigator, I took the time to listen to her needs and kind of prioritize and see how we could maybe target what was priority for her and take it one step at a time.
That was such a blessing because I didn't even know that I could even go to the health department like that because I was in so much pain. I couldn't have done that myself.
If it weren't because of the services that maybe I assisted her with, I don't know what would have happened in her life, and without me knowing it, I've made such a difference in someone's life.
I really appreciate you for just being there for me. Thank you so much. Thank you.
Well, this program fits directly with the core values and the mission of St. Thomas Health and Ascension Health.
And who looks after the child while she's at work?
The 2-in-1 Health Navigator program is just vital to our 2020 goal of healthcare that leaves no one behind.
2-in-1 is here 24/7, so you can call us anytime you need any assistance.
The goal then is to take the learnings and how we've implemented the program and to share that information with our ministries throughout the Ascension Health system so that those that are interested can use that information to start a similar program in their community.
¿Y usted necesita a una clínica?
You never know how one thing you can do or say can make an impact in their life forever.
People will call back and they will say, "Thank you so much for helping me. I was able to get the assistance that I needed."
Gracias. ¿Y recibe algún otro programa del gobierno? It's very satisfying knowing that they are grateful for the job that we do here at 2-in-1.
I do feel very grateful for having called 211 and worked with the Health Navigator.
We do have a couple of providers that I can
I'm very thankful to have met Cheryl at this time in my life, and she helped me walk through an important crossroads.
I've been able to be blessed with strategic partners such as 211 and others around the community that can help us.
If they get a positive connection with us, that sets them up for success for later on.
We all love 2-in-1. We love the service we do, so I do believe everyone that works here has that heart.
The LIFT program, it covers you when you're waiting on your approval.
211 Navigator program is turning on the light to healthcare.
I have faith that with our doctors and the good doctor that I've gotten with this program, she's going to do the job, and I'm going to live. I'm going to live.